Have you been suffering from joint pain and you are wondering what are those foods that are making your arthritis worse, causing you to have more pain, more inflammation, and worsen your disease? I am Dr. Girnita, an arthritis doctor, and today I will teach you what are the worst foods proven by science that will worsen your arthritis. Stay until the end because I will share with you also the foods that you need to eat to improve your arthritis. Let's begin.
Rheumatologistoncall.com.
First, let's talk a little bit about arthritis. Arthritis is a term that is used in medicine for about 100 types of arthritis. But some types of arthritis are caused by inflammation, like rheumatoid arthritis, lupus, psoriatic arthritis, while other types are caused by wear and tear or repetitive trauma, like osteoarthritis. And this happens many times when we age. And there are also other types of arthritis that are caused by crystals that can deposit in our joints. Such a form of arthritis is called gout. What all have in common is pain, stiffness, and decreased mobility of your joints. Now, science showed that there are certain foods that can increase your weight and will also cause more inflammation in your body. The increase in your weight will be responsible for putting more pressure on the joints. But not only that, our adipose tissue can also secrete some proteins and hormones. One of them is called leptin, that will increase the inflammation and will also lead to joint destruction. Now, let's find out what are these 5 worst foods. Sugar. I often tell my patients that if they can remove the extra sugar from their diet, half of the battle is won. Why? Because sugar is the worst substance for your body. Not only that will create addiction, will increase your weight, will cause obesity, insulin resistance, even diabetes, inflammation in the gut, but will also increase the risk of cancer, Alzheimer, and it will create more and more inflammation that will cause destruction of your joints. Too much sugar can also cause fatty liver. Here is a study done in United Kingdom in 2018 that showed that people that consume sugar or sweetened beverages like coffee and tea or sweetened cereals did cause more diabetes, obesity, heart disease, and higher markers of inflammation. Furthermore, sugar was also shown to increase the risk to develop autoimmune diseases like rheumatoid arthritis or even gout. Here is another study from 2014 that looked at more than 100,000 women over 20 years, and they find out that drinking more than 1 soda each day will increase the risk to develop rheumatoid arthritis with 65%. Not only that, but sugar will exacerbate the pain and inflammation if you suffer from rheumatoid arthritis and psoriatic arthritis. High fructose corn syrup is also a form of sugar. And actually, it's a cheaper version of sugar that is added to many foods, drinks, packaged food, or even baked goods, in soft drinks, as I said, and also in energy drinks. There are many studies showing that high fructose corn syrup is damaging your health. Here is a study that shows that high fructose corn syrup will increase the uric acid levels and will increase the risk to develop gout, but also rheumatoid arthritis. Now, sugar is in everything these days, not only in the sweets, candies, cookies, pastries, but you find sugar in the drinks and even in the bread or ham. There is sugar added to many of so-called healthy juices. So my advice, the first thing that you want to remove from your diet is sugar and added sugar. Processed foods. Processed foods like processed meats, frozen pizza, sweetened cereals, ham, salami, burgers. Actually, many of the packaged or frozen foods including some of the canned soups, packaged cereals, instant foods, or microwavable meals, are highly processed. Why to avoid this? Because most of their nutrients have been stripped out, and ingredients such as salt, sweeteners, artificial flavorings, all kinds of emulsifiers have been added to them, oftentimes to improve their shelf life. Now, processed foods also include a lot of bad fats, trans fats, and they are stripped from fibers. One study looked at individuals over about 2 weeks, and they find out that those who consume a diet of ultra-processed foods, they gain 0.4 kilograms, while those that ate a plant-based diet, minimally processed diet, they saw actually weight loss. These foods are unhealthy for everyone, but particularly harmful for people with osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and even gout. Science showed that eating ultra-processed food will increase the risk to develop those diseases, like gout and rheumatoid arthritis. And even more, accordingly to this study published in 2020, eating ultra-processed food will increase the cardiovascular risk in people with rheumatoid arthritis. What does it mean? It will increase your risk to develop a heart attack or even a stroke because of increased inflammation. Yes, eating ultra-processed food can increase your risk for disease, but will also increase your risk of mortality with almost 20%. So stop eating that packaged food, that processed food, and start cooking from scratch at home. That will help your arthritis, but will also prolong your life. Bad fats. I will start by saying that not all fats are bad. Fats are needed for our body, but certain fats are good and others are bad. Now let me explain more. Unsaturated fats, like monounsaturated or polyunsaturated fats, are the good ones. And I will include a list of all of this a little bit later in this video, so continue to watch. These kind of fats are needed for our body and they are good for our body. The bad fats or unhealthy fats are the trans fats or highly saturated fats. Trans fats are usually present in processed food like fried food, frozen pizza, ice creams. These are type of fats that were modified by the food industry to make the vegetable oils to appear more solid and give that desirable texture and flavor to food. A lot of fried food contains trans fats. Trans fats are associated with increasing the bad cholesterol, more inflammation, and obesity. And obesity was also associated with worsened inflammation and worse arthritis, as we discussed. Another type of bad fats are the saturated fats. Usually those are present in processed cheese, processed food, butter, and meat. Although a little bit of saturated fat, like eating butter in moderation or eating a little bit of red meat, not every day, was not shown to affect the health. But when you are eating meat or red meat every day, or eating fatty foods or fried foods, that will increase your weight, will cause obesity, will increase your cardiovascular risk, and will increase the risk for heart attacks. As I discussed before, obesity will increase those leptin levels, and this is a hormone that was shown to increase inflammatory markers like TNF-alpha, IL-6, IL-1, and all of this will create more inflammation in the joints, and more inflammation will cause cartilage destruction and osteoporosis or thinning of the bones. Refined carbohydrates. Refined carbohydrates like white bread, white pasta, pastry, breakfast cereals, even the white rice will also increase the glycemic index, which will cause an increased risk for diabetes, again obesity, heart disease, and will also increase the risk for inflammation. Many of these foods contain very few fibers and also gluten, which will cause gut inflammation and sometimes leaky gut. More inflammation in the gut will increase the inflammation in the whole body. In a study that was published in 2021 that looked at patients with rheumatoid arthritis, the autoimmune type of arthritis, patients that remove gluten foods along with lactose and red meat for about 3 months, they did show a significant improvement in rheumatoid arthritis pain and inflammation. So trying to remove gluten from your diet has a great potential to improve your symptoms from arthritis. In just a few minutes, I will share with you what will be the foods that you should use to replace refined carbohydrates. Alcohol. You may raise your eyebrows when you hear about alcohol, but let me explain you more. There are studies from people in the Mediterranean areas that show that people that do drink moderately, just a few glasses of red wine per week, they do have a decrease in their cardiovascular risk and reduce inflammation. Now, please pay attention. Alcohol in small quantities, especially red wine, may be beneficial. The beneficial effect comes from the polyphenols, the flavonoids that have an antioxidant effect on our body. However, drinking alcohol in excess, like drinking every single day, multiple glasses of wine or alcohol per day, is damaging your liver and your health. And the type of alcohol that you drink matters too, because drinking too much beer, too much wine, and drinking too much hard liquor, it is not recommended because it will cause gut damage, gut inflammation, liver failure, and even increase the risk for arthritis, especially gout, even rheumatoid arthritis and psoriatic arthritis. So drinking too much alcohol will worsen your arthritis symptoms. This study from 2004 showed that people drinking lots of beer and hard liquor will have an increased risk to develop gout. Another study showed that drinking hard liquor will increase the risk to develop a severe form of gout with tophi. Those are uric acid deposits around the joints that will eventually cause deformities in the joints and will destroy the joints. So stay away from drinking a lot of beer, a lot of hard liquor. Use red wine in small quantities, but once again, not every day. Now, as a bonus, let me share with you a list of the best foods that will help you decrease the inflammation in your body and decrease the pain from arthritis and also prevent further damage of your joints. All these foods have anti-inflammatory properties and will help your arthritis, but will also impact your whole body, will decrease the risk to develop other chronic diseases, and will expand your life expectancy. So not only that you will live longer, but you will live a healthier life. Fruits, especially berries like blueberries, strawberries, blackberries, are great for people with osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. In 2017, a study in 300 people with rheumatoid arthritis, it showed that people that eating blueberries or strawberries, they felt better with less pain and less inflammation. Fruits like papaya, pineapple, or mango are also great to reduce inflammation. Cherries are particularly helpful for people with gout. Here is just one of the studies that show that eating one handful of cherries every day help people with gout to reduce the gout attacks number. Vegetables like broccoli, spinach, kale, asparagus are very healthy. The darker the green color, the better, because they contain a lot of vitamins and fibers. And lots of fibers will make you feel fuller for a longer period of time, will decrease your hunger, and will maintain a healthy weight. Leafy green vegetables are also at the base of the vegetarian and Mediterranean diet, with great benefits for patients with rheumatoid arthritis, but also psoriatic arthritis, gout, and osteoarthritis. If your weight is normal, remember, the risk of arthritis is lower. Whole grains like quinoa, wild rice, brown rice, or gluten-free oats. Corn are again high in fiber, which will help you feel fuller for a longer period of time, lower cholesterol, feed your gut bacteria, and decrease the inflammation and the signs of arthritis. Legumes like beans, peas, garbanzo beans are very rich in proteins, are very rich in fibers, in vitamins. Think about the B complex like B1, B2, B6, lots of minerals like iron, calcium, potassium, phosphorus, zinc. And because of this high content of protein and fiber, eating legumes will avoid you to have insulin spikes and will avoid you to feel hungry all the time, and that will lower your risk of obesity and the risk for diabetes and arthritis. And again, legumes are the staple food in the Mediterranean diet. That's why I encourage you to start eating this type of diet. Omega-3 fatty acids are also very good for your health, and they are primarily found in fishes like salmon, trout, sardines, but they also are found in lower concentration in olive oil, in chia seeds, in flax seeds, and it is proven by many studies over the year that eating a high diet in omega-3s or even taking a supplement will decrease inflammation, decrease pain, decrease swelling, and very important, you will decrease that need to take more and more ibuprofen or naproxen. Fermented foods. Why fermented foods? Because they are a natural source of probiotics, and that again will help your gut to decrease inflammation. A few examples of fermented foods are dairy, like yogurt, kefir, or cultured sour cream. But also fermented foods are like sauerkraut, fermented pickles, or kombucha, which is a popular fermented sweetened tea. They all have powerful anti-inflammatory effect on your health. If you want to learn more about anti-inflammatory foods for arthritis, subscribe to my channel as I am planning a new video only about anti-inflammatory foods for people with different forms of arthritis. But now that you learn about the worst foods that will create inflammation and more pain in people with arthritis, you should watch this video that talks about the worst and the best foods for psoriasis and psoriatic arthritis.
Rheumatologist on call.com.